that poor oral hygiene also contributes? Like, I see patients have an overgrowth tissues when they have braces, and you cannot see the teeth anymore. And when they come to me and they'll ask me, is it going to be gone or what do you want me to do? I said, you need more oral hygiene, you know, good oral hygiene. You have to brush, really brush. Is that the cause of that, the poor oral hygiene? Is it going back to normal after the braces is out?
Poor oral hygiene, whether you're wearing braces or not. If you're not wearing braces and your hygiene isn't what it should be, you will see that your gums bleed and they get swollen. With the braces, it only compounds it because the food collects even more because of the braces that are on the teeth. Often, once the braces come off, the gum tissue will shrink back. Sometimes it's necessary to have some gingival or periodontal work done.
How long before it go back? Is it necessary to have a gingivectomy or cutting of the gums in order to speed up, you know, going back into a normal gum?
After the braces are removed, if the gum tissue is very, very swollen, the patient has to have a good oral hygiene appointment at their dentist, and then it usually goes back within 2 to 4 weeks. Okay. If it doesn't really shrink down enough, then we would look at a periodontal solution.
Now, my last question to you is about adult treatment. You know, I see patients, they are already grown up in an adult stage and they have overlapping. And as a general dentist, you know, I see that and I told them if they're interested to change, you know, their normal, you know, their occlusion at this time, not occlusion, but the bite of the patient. And I mentioned to them there's an adult orthodontic or adult treatment at this time. And I asked them if they want it, or if they want me to refer to them, to Dr. Abramowitz or to any orthodontist. So can you tell us about that adult treatment?
Adult treatment now in most orthodontic practices is at least 15%.
Okay.
My practice most likely is about 20%. For some reason, I've always had a lot of adults come in for treatment. Adult treatment would involve sometimes wearing Invisalign trays, as I showed before. A lot of people like to wear that because it's invisible. And another way that we have our adults is wear ceramic braces. Ceramic braces are really invisible, and we use white titanium wires. It's quite...
It's good, you know? That one has a different kind of colors, right?
This one
like a green or red, you know, and this one is clear. I like the clear.
These are the clear braces. These are the more traditional braces that most of the children are wearing. And I have colors to show that with braces now, it's not like it was years ago. The kids put on different colors depending upon where they go to school, what sport team they are on, what holiday is coming, and we change the colors each time that they come in. It makes it a little bit more fun for the kids. But adult treatment, all of the adults will choose a ceramic brace or the Invisalign system because these are really not very noticeable. In fact, Tom Cruise, I think, completed his treatment with these braces about 2 years ago. I didn't even realize he was having treatment until I saw an interview with him. And I said, am I seeing something on his teeth? Because my eyes always go to a person's teeth. And I realized that he was having orthodontic treatment.
I like what you said, your eyes is always on the teeth. I'm doing that now.
Most people have eye-to-eye contact. I think dentists go eye to teeth.
Oh, eye to teeth, all right. Now, Dr. Abramowitz, why don't you show us your office, please?
Wonderful.
Okay, thank you.
I'll take the x-ray room, and we take a Panorex and a Ceph, which measures out the growth potential of patients, sterilization area, and laboratory. Most orthodontic offices have open bay concepts, and it keeps it very, very informal because our patients are young and they feel more secure with other children around. And we also have a chair by each chair, treatment chair, where the parent can come in and sit.
I think you gave us enough information, so much information for the viewers to understand the meaning of orthodontics or orthodontist. Dr. Stephen Abramowitz, thank you so much. You know, I appreciate it so much on my first show that you are my first guest. And to you, I will try my best to invite another dentist, which may be a periodontist, a specialty on the gums, and give you some information or updated information of what they do to save your gums and, of course, to save your bone and teeth. Thank you and have a nice day. Goodbye.
Thank you very much. It was fun.
Yeah, thank you.